Hello and welcome to the Victoria General Hospital overview of EDIS clinical documentation for emergency consulting physicians. This video is intended for physicians that have used clinical documentation at either St. Boniface or Seven Oaks Hospital. On May 26th, the Emergency Department Information System, otherwise known as EDIS, at Victoria General Hospital Emergency Department is expanding to include electronic clinical documentation. The EDIS ClinDoc set being introduced is similar to a set already in use at St. Boniface and Seven Oaks emergency rooms. St. Boniface also uses a similar set of clinical documents in the inpatient areas. This table overviews the clinical documents that are going to be introduced at Victoria, in contrast with those documents already at use at Seven Oaks, St. Boniface ER, and St. Boniface Inpatient. The documents going live at Victoria are the Assessment Note Emergency Prescriber, Assessment Note Emergency Nursing, Progress Notes, Vital Signs and Care and Assessment Flow Sheets, Procedure Note, Discharge Summary Note Emergency, Consult Request Note, and the Consult Note. The Seven Oaks and St. Boniface emergency rooms have identical clinical documentation documents with the exception of the Consult Request Note. Since St. Boniface uses physician order entry, the Consult Request is done using an order. The Consult Request Note will be going live at Seven Oaks Emergency Department, but is not yet in place. Victoria will be going live with the Consult Request Note on their go live May 26th. The last column shows the St. Boniface inpatient documents that are of similar nature. So the history and physical is similar to the Assessment Note Prescriber. Initial assessment, similar to the Assessment Note Nursing. And the Discharge Summary, which is similar to the Discharge Summary Note Emergency. Along with the introduction of clinical documentation at Victoria Hospital, we will also be introducing an auto-faxing of visit summary report to the primary care provider, and that will be faxed as soon as the emergency physician approves the discharge summary. We are also planning additional workstations, and in the event of either an EDIS or network downtime, we're incorporating downtime procedures that would still allow the clinical information for patients within the emergency department to be available. How are consulting MDs impacted? Once clinical documentation is live in EDIS, consulting MDs will be able to view the patient chart and specifically their consult request through the EDIS Documents tab. They'll be responding to the consult request using the consult note, and optionally, additional documentation can be done using the progress notes and procedure notes. A optional summary to the primary care provider can be done through the healthcare team section of the discharge summary note. The day prior to the go live, May 25th, there is an open lab located on the basement of Victoria General Hospital in classroom number 1. This is available for any users to practice. During the go live, starting May 26th, there will be a command center on site to assist with troubleshooting, rovers and super users to assist users in the emergency department, and service desk will be available to record the incidents on site. I will now take you through a demonstration of the documents that are planned to go live at Victoria Hospital. To view the patient information, you have to first highlight the patient on the EDIS board, Then you can select the Documents tab. The Documents tab shows all documents, and the default is to be sorted by date. You can change the sort by choosing a different display format, such as by discipline. To open a note and read, you can just double-click and use your scroll bar to view document. To close the document, you can use the red X in the top right-hand corner. As part of the clinical documentation rollout, the flow sheets being introduced, care and assessment, and vital signs flow sheet, are identical to those being used at Seven Oaks and St. Boniface Hospital. You may also choose to view the clinical summary for the patient. The clinical summary, there are 3 views. These are identical to the views in use at St. Boniface and Seven Oaks Hospital. When choosing the physician view, there are graphs for blood pressure, heart rate, and temperature. However, the sections for blood glucose insulin and INR warfarin will not be in use at Victoria Hospital. Once the chart has been reviewed, you may wish to check the Consult Request on the Documents tab. To open the Consult Request note, double-click, and you can see the Consult Request will contain the service being requested, who has requested the consult, the type of consult, as well as indication and relevant clinical history for the patient. Notification of a consult request will be the same as it is currently. So if you get paged, the unit clerk will notify here within the note the date and time and who is notified. If you receive faxed consult requests, they would be continued to be faxed. Upon assessing the patient, if you want to now record your findings in the consult note, this is done through the Quick Launch Docs button by selecting the arrow next to the button and choosing Consult. The consult response note is the same one used at St. Boniface and Seven Oaks Hospital. To fill out the consult, you want to first select your consulting service or discipline. This ensures that the document is sorted correctly on the Documents tab. You can then fill in who requested the service, requested the consult. And then using the sections pane on the left-hand side, you can choose to document in any of the sections listed. None of the sections are required, and you can fill them out based on patient need. The first section is the history present illness, medical history, family history, social history, allergies, and these sections are identical to those in use at St. Boniface. If the patient has already got information recorded, you can choose to include it by checking next to the item. The remainder of the sections are review of systems, vital signs, physical exam, body images, lab results, diagnostic results, and consultant findings. The consultant findings section is a text field which can be typed in what your findings are. If you use acronym expansion, your same acronym expansions will be available as you use at the other hospitals. Victoria Hospital is not using the Impression and Plan section. Recommendation section is a text field which is optional for you to fill out. And we do recommend for any consult that you add yourself as a care provider. To add yourself as a care provider, select first this section, choose the plus sign, and select Add Me. This will automatically fill in your name. You will have to select your role, in this case, consulting. Once your note is complete, you can press the Save button. If you are complete, you can submit as final. I will now briefly show the other notes that may be used by consulting physicians. The Progress Note Comprehensive, which is identical to that used at St. Boniface and Seven Oaks Hospital. The Progress Note General, which is a more simplified progress note with a text field to be typed in, and is also used at St. Boniface and Seven Oaks. You may use the Procedure Note. The Procedure Note drop-down has listing of all the procedures available. Once a procedure is selected, the note gets customized to that procedure, including a procedure additional details text box. Consulting MDs may also add healthcare team notes to the discharge summary note emergency. Any notes in this section can be sent or will be included in the auto fax sent to the primary care provider upon patient discharge. To include your note, please indicate the service or discipline in the drop-down list, as well as the date and the text field for the summary. When saving the discharge summary note, it'll automatically save as incomplete. That concludes the demonstration for the EDIS clinical documentation that is going live at Victoria Emergency Room on May 26th. If you have any questions or points in this video or require further information, please use the contact information listed on screen. Thank you.